Hi everyone, this is Dr. Mike. Welcome to my YouTube channel. I'm based here in Hong Kong. I'm Doc Mike. And welcome to my YouTube channel, Health Talk by Doc Mike. And also to my Facebook page, Health Talk by Doc Mike. And if you're not yet a subscriber, please do like, share, and subscribe my YouTube channel, Dr. Mike Manyo. And also hit that notification bell so that every time that we have an upload, you will be notified. For all our viewers and friends on Facebook, please do follow us and like us on Health Talk by Doc Mike. But before we move forward to our discussion, allow me to say thank you to all the viewers, comments, feedbacks of our subscribers, viewers regarding our past episode. If you failed to watch our previous episode, please you can go back and you can check our library regarding our past episode. So once again, thank you very much. Our featured medication for today is all about amlodipine. I believe that most of you are familiar with this medication because this drug is used for high blood pressure or hypertension. And this is one of the most common prescribed medication among doctors to our clients with elevated blood pressure. So, without any further ado, let's discuss this medication, the uses and the side effects of amlodipine or Norvasc. Amlodipine is a calcium channel blocker medication used to treat high blood pressure and coronary artery disease. It is commonly branded as Norvasc or marketed as Norvasc in different formulation. So the amlodipine as mesylate 10 milligrams also contains sodium and it's under Pfizer. Okay. While not typically recommended in heart failure, amlodipine may be used if other medications are not sufficient for treating high blood pressure or heart-related chest pains. Regarding its pharmacologic class, amlodipine, as I've mentioned, is a long-acting calcium channel antagonist that selectively inhibits calcium ion influx across cell membrane. This medication has a common name Norvasc, formulated usually 2.5 milligrams, 5 milligrams, and 10 milligrams. In terms of pharmacology, amlodipine Norvasc has a bioavailability of 64 to 90%. It has a protein binding of 93% and it is metabolized in the liver. The metabolites various inactive pyrimidine metabolites and the onset of action with the highest availability of 6 to 12 hours after the oral dose. The elimination half-life of amlodipine is around 30 to 50 hours. It has a duration of action at least 24 hours and it is excreted via the urine. So the major organs involved again are liver and the kidneys. How about the mechanism of action of this medication? Amlodipine works by blocking the voltage-dependent L-type calcium channels, thereby inhibiting the initial influx of calcium, reduce intracellular calcium, which leads to decreased vascular smooth muscle contraction or contractility, and increased smooth muscle relaxation, resulting to vasodilation. You could see in the picture, in terms of the uses of amlodipine or Norvasc, and as I have mentioned a while ago, this is one of the common drugs that doctors prescribe to clients or patients, particularly if patients have high blood pressure or elevated blood pressure, which doctor refers to as hypertension, coronary artery disease, angina, which is characterized by sudden chest pain from a reduced blood flow to the heart, and a very rare case, Reynolds phenomenon. What are the most common side effects? The common side effects of this medication, if you are taking this medication, amlodipine or Norvasc, regardless on which milligrams, be careful because some patients may experience these side effects, because not all patients may experience this. However, in certain numbers or few numbers of clients or patients taking amlodipine, particularly those patients who are taking this drug just buying from the pharmacy, particularly those under on self-medication without any prescription. Remember, this amlodipine requires a prescriptions to your doctor. Okay, you should not take this medication without any prescription. Okay, so that you should the doctor should explain to you as well the side effects. The first one would be edema. Some patients may experience swelling that occurs in different parts of the body, particularly on your dependent areas such as the feet or ankles. So, the side effects aside from edema, some patients may experience dizziness, flushing, or palpitations, which are feelings of fast or irregular heartbeat. So some patients, as I have mentioned, may experience this flushing or redness, particularly on the upper extremities, particularly on the face. Palpitation is also common among patients, particularly taking this medication as one of the side effects. This is characterized by feelings of a fast or irregular heartbeat. Remember that the normal heartbeat is between 60 to 100 beats per minute. Below 60, it is bradycardia. Above 100, it's tachycardia. So it should be falling between 60 to 100. And if you have this irregular heartbeat, kindly stop the medication and go to your physician. Other side effects would be less common among patients. However, some patients watching us, you might be experiencing headache, fatigue, nausea, abdominal pain, drowsiness, gingival overgrowth, somnolence or sleeping or sleepiness. Or sometimes patient may have this impotence or erectile dysfunction, particularly if this drug is given to male patients. So we advise also male patient taking this medication, they may experience this erectile dysfunction. However, in rare cases. This medication should be given to patient with important warnings. You need to inform patients most of the time that this medication may lead to hypotension or low blood pressure in some patients, particularly those with severe aortic stenosis, problem of the aorta, and symptoms of hypotension include feeling faint, tired, and nauseous. Sometimes you have this feeling of vomiting. Another one, this would increase angina or the sudden chest pain or myocardial infarction. It can worsen symptoms of angina. So if you are suffering from angina or the increased risk of heart attack in some people, particularly for those who have severe obstructive coronary disease. So watchful for this specific or important warnings. And lastly, you should also remember that doctors should be cautious when prescribing this drug to people with liver conditions. If patients have liver cirrhosis or problems, any fatty liver, so be very careful. That's why there are some doctors would request a baseline liver function test or kidney function as well, so that we would have to monitor the liver when taking this medication, particularly if you are taking this medication for maintenance for your high blood pressure. So you need to visit your doctor so that your liver will be checked from time to time. Once again, always be safe and be healthy. Do not take medication right away. Do not self-medicate. Always visit your physician, consult your physician so that the physician can guide you, can give you the proper instructions in taking these medications. So once again, this is Dr. Mike. Thank you so much for listening and watching uh, on our Health Talk by Doc Mike. And if you have questions, feedbacks, and comments, please do share your feedbacks and comments. And don't forget to share, like, and subscribe. Hit that notification bell so that you would be notified every time that we'll be having an upload or doing live. And if you are on Facebook, you could also follow us on Facebook, Health Talk by Doc Mike. So once again, thank you so much for watching and joining me. See you again in our next episode. See you guys. Have a great day, everyone.